Hey everybody, it's John DeYoung, and today we're going to talk about post-prostate cancer urinary leakage and how to stop the leaking. 1 in 8 men are going to be diagnosed with prostate cancer in their lifetime, and it's the second most common cancer. So today's video is going to address those of you who've had cancer, you've gone through the treatment, and now you're struggling with this urine leakage. As you know, the prostate is located just below the bladder and surrounds the urethra. Now, removing the prostate or having gone through radiation can cause damage to the nerves, muscles of the bladder, urethra, and the sphincter, which controls the flow of urine from the bladder. The pelvic floor muscles are really important here because they help control bladder and bowel movements and function, and if they get weak, they're no longer able to do their job efficiently. So as you can see here, the pelvic floor muscles stretch from the pubic bone at the front of your body, underneath your bladder and bowel to the bottom of your spine. Now, the muscles of the pelvic floor act as like a sling to your bladder and bowel, and helping control when you urinate and when you empty your bowels. They also help they also have a function, an erectile function. So now we have to learn how to strengthen your pelvic floor. This is an exercise. It's a male Kegel exercise. It's important to do this also, these exercises, after you empty your bladder. So you're going to actually start on your back. Okay, it's really important to breathe normally. You don't want to engage your abs, okay? Relax your quads and your butt. So what you want to think about is trying to squeeze your rectum, trying not to pass gas, or trying to squeeze or cut off the flow of urine. And you're going to hold it for 1, 2, 3, 4, and 5, and relax. Now, I was actually using some abs there, so why don't you relax? Again, no legs, no butt, and squeeze and hold for 5, 4, 3, 2, 1, and relax. You can do these standing up. I prefer kind of laying down because now I can feel my stomach, my legs, and my butt. And now I'm just going to contract my rectum and hold for 5, 4, 3, 2, 1, and relax. When you start engaging your tummy, then try to relax and just start all over again. So we're going to do this about 5 to 7 times in the first week or so. 3 times a day, okay? So again, really get good at this. Squeeze. Make sure your stomach's relaxed, holding 5, 4, 3, 2, and 1. Okay, it's really important to start strengthening that pelvic floor muscle. So as you get stronger, maybe in a few weeks, you can actually start doing little bursts. 1 second squeeze, 1 second squeeze, 1 second squeeze, 30 in a row, and then relax. And then go into a longer duration hold for about as long as you can before you start using your abs and your butt. Maybe a longer duration hold of maybe 20 seconds. And then relax for another 20 seconds. And then go back into the boom, 1, squeeze, let go, squeeze, let go, squeeze, let go. So we're going to do about 30 of those, 1 second holds, 30 in a row, and then relax for a good 5 to 10 seconds. And then do one that's a longer hold, again, about maybe 15, 20 seconds. So again, 1 sitting, 5 to 7 sets. It's got to be done 3 times a day, every day. And the interesting thing is, if you feel you're having a little incontinence, you're leaking urine on your way to the bathroom, stop. Do a Kegel exercise, squeeze your rectum, hold it. Hold it for as long as you can, then relax. Go to the bathroom, empty your bowels. Sometimes people have leakage when they sneeze or cough. So if you feel a cough or sneeze coming on, again, engage your rectum, do that Kegel movement, squeeze and hold. That's going to allow less urine to leak out, so you don't have to keep changing your undergarments. And remember, breathe normally, relax your quads. You can stand up and do it. You can do it pretty much anywhere. You can do it at your desk at work. You can do it driving the car. It's really something you really have to do a lot to notice. You probably notice less leakage in about 3 to 4 weeks. And that's when you can kind of add maybe longer duration with the little short 1 second bursts. And you also may want to check with your doctor, because I understand that certain drugs, antidepressants, ACE inhibitors, I had a client on gabapentin, they actually relax the urinary sphincter. So that would definitely cause a little a leakage. Also cut down on caffeine, stay hydrated, and make sure you have good bowel movements, again with hydration and fiber. because being backed up can also cause a little leakage. So, all right, everybody, I hope that helps. If you have any questions, put them in the comments. Hit subscribe if you haven't already, and good luck with that, and I'll see you soon.